shoot, I don't have my glasses. It's okay.
No, you don't need. You
Okay.
see me?
Yeah, good morning. How's your coffee?
My coffee's good.
Is it?
Yeah, it's always good. It's coffee.
Hmm.
It can't be bad. I mean, it can be bad, but I'm not really picky.
Who makes better coffee, you or me?
Me?
Really? Have you tried making that Kenyan stuff in there? It's difficult.
Oh yeah, that one has a little kind of. I gotta try again.
It tastes good, but I think I made it too strong.
Yes.
But I challenge you to try.
No,
It's
well,
tricky.
it's different
It's not
than
too-
your regular coffee because it has that earthy taste. You
Mhm.
know,
Mhm.
it's like, I guess that's how Kenya tastes.
I don't think so, honey.
I don't know. I've never been to Kenya, but
Ah.
it was interesting.
Try
yes.
Kenyan coffee.
So today, we wanted to talk more about importance of patient advocates and kind of give an example of what that is like and how it can make a difference. Joann wrote an article about her experience, and it's on the website, drugsandcoffee.com. You can go check it out.
It has a slightly different slant. It's slanted more towards talking about a severe adverse reaction, but underneath it all is the importance of being
Right. I mean, the
a
whole
patient
story.
advocate.
I mean, the stories really.
Right.
They're interesting, and it really kind of brings us to kind of the discussion of why is it important to have somebody in your corner.
Yeah.
Not necessarily to challenge anybody.
No.
It's just to be there to monitor and kind of pay attention.
Mm-hmm. To draw
And
attention
in
to.
my business, also home infusion,
Mhm.
it is super important to have caregivers
Yes.
because we have patients that are in the house
Mm-hmm.
getting their medication
Mm-hmm.
on their own. Nobody to really look at them except their caregiver.
Absolutely.
So it scares us when we have somebody who lives on their own. So
With that said,
with that said, your story, we can tell us more about. So how did it happen first? Like what
Mhm.
was your first story and first exposure and kind of realization that, oh my God, I have this knowledge and I can actually use it.
well, I think, Marco, you started that off. We went to show my mother the engagement ring that you had gotten me.
Well, let's kind of give kind of perspective of when was this? Like this was
Okay.
it first happened. You were in pharmacy school.
Oh, you want to go that far back? Okay, let's
Well, I mean,
start
come
there.
on, yeah.
All right, let's start back there.
That was your very
Oh,
first
my-
experience,
Right. Okay. So we had just studied Stevens-Johnson syndrome, which is basically Stevens-Johnson syndrome is one of the worst reactions that can happen to you once you've taken a drug, and it can happen at any point. That's the scary point. It doesn't have to be within the first 10 days. It can happen 30 days after you've taken the drug, and so forth. What happened? We had studied this horrific reaction wherein if you take a drug, you slowly develop this rash, and it's a very telling rash. It's a purplish rash that starts in your genitalia area, and then it can progress down your legs, and it sometimes can manifest itself in your ears or on the palms of your hand, and it's this dark purple rash. Usually on Caucasian people, that's really what it'll look like. It'll have this rich, royal purple color.
Okay.
But in African Americans and people with more melanin in their skin, it's going to present a little bit differently. It's just going to look darker as opposed to more purple.
Right.
Anyway, so
Which
it was,
makes sense.
it was very clear.
So
in
you
school,
went to this class. You saw all these
and I kid you
gruesome
not.
pictures.
Yeah, and then we had to go to lunch, and right after lunch, I got a phone call from my mother who lived in Pennsylvania, and she said, "Joann, how are you doing? You know, I just developed this purplish rash in my genitalia area, and you know, it is spreading down my legs. I kid you not. This is not the syndrome where, you know, a person studies this in medical school or in pharmacy school and then they diagnose themselves. No, it really happened. And I said, Mom, I need you to go. And she described this, and I said, Mom, I need you to go right now to Geisinger. and get checked out. She's like, oh, but it's raining. It is raining. I don't want to go anywhere. I'm just going to wait till the morning. I said, well, you know what? I was so horrified by what I had just seen, and she had described it textbook to me. I said, if you do not go there, you're in danger. And I just escalated the process of your skin falling off in sheets, and you will die of an infection. And that's what I told my mother. And she just said, well, okay, I know you're new at this. You're not even a pharmacist, but I will listen, daughter. And she went up there, and you know what she had? Steven Johnson syndrome.
Isn't that crazy? Like you literally that day.
That was telltale sign. That day I saw it, and once you've seen those pictures, you never forget them. And then imagine the phone call from your dear mommy, and that's exactly what happened. And when she got there, of course they gave her steroids, to help bring down.
What did they figure out? What was the cause?
They at that point
because something triggered it.
Yeah, I don't know how they figured it out that it was Zocor. I don't know to this day.
Okay, but that's what they
said
thought.
It was Zocor because they stopped her taking Zocor, which is one of the statins, very potent statins. They stopped her from taking that, and it went away, and they treated her with a lot of serious steroids.
This is not something that's specific to Zocor. It can happen
to any drug.
Really.
Yes, it really can.
It can be triggered.
And she had taken Zocor for years and years, so it was really hard. I don't know how they reached that answer, but
I mean, it's kind of like you can take something forever, and then all of a sudden you're allergic to it.
That's exactly
or you
what
can
happened.
eat a particular food, so it's really just your immune system responding to it.
Mm-hmm, mm-hmm.
So that was the first example of kind of you advocating for your mom, essentially. Like, okay, you need to do this.
Yeah, well,
right?
First thing is you can, by your knowledge, whatever small, if you feel something is wrong, you tell the person, urge the person to get help. You may not have, gone to pharmacy school, seen a clip, but if something that severe is wrong, your skin should not be changing colors that quickly, you definitely get some help. And that's the point of that little story. Fast forward years later, people in my family stopped telling me things because I would force them to go to the doctor immediately. So my sister kind of hinted to me a couple of years down the line that, Mom is having these very funny seizures, and she doesn't want to tell you about it. So I said, well, we'll just go visit her. And so you and I headed down to Pennsylvania with the idea to show off my new engagement ring.
Right, yeah.
Yeah, that was important to do, but it was another secret mission to see what these seizures were all about. So we get down there, and you remember, I think you were more calm. We were just headed there to see her, and we were on our way to a wedding in California, After we were going to leave and then go to that wedding. And then what ended up happening?
And one thing led to another. I mean, we essentially recognized that something was really wrong, and
you said, let's go see
her
doctor,
local doctor, who she did her best, but she couldn't really spend too much time on it.
Well, what it was my mother over the years had befriended her doctor. So once you get in that friendship kind of mode with your the curiosity, as a doctor, kind of
there's a bias.
There's a bias,
and you
kind of listen to your patient.
The
patient doesn't really want an MRI, so you don't give it. So when Marco and I went down there, you basically suggested to that doctor, please, have you thought of an MRI? And that was the day she got an MRI. Is that correct?
Yeah.
And then she suffered there from a serious allergic reaction to gadolinium.
Oh yeah, I forgot gadolinium.
I did not forget that.
Yeah.
Gadolinium is it called gadolinium? When they went in, they give you this colored dye.
Oh, poor woman.
She went through it. They put this dye so that it's very easy to see what's going on in the brain. But what ended up happening is she was very severely allergic to gadolinium, and so she had a rough time with the MRI. But anyway, through the MRI, they found out. I'm not sure what happened after that.
No, I mean MRI. They told us, listen, there's a tumor.
Yes, that's what happened.
After that, one thing led
to another, and she kept complaining. Then we went to play tennis that same day, and she complained that she felt drunk. That's how she described it. And my mother's allergic to alcohol and she does not drink.
Yeah, I mean, at this point,
But
it
she
was,
started
it was
describing
growing, it was,
symptoms of being drunk
yeah, the
and
tumor was
unable
growing.
to walk.
But, that whole example of
Mhm.
just, I don't like the word pressuring, but advocating is probably best.
Mhm.
It helps.
Mhm.
It helps to kind of look at things from a different perspective.
Mhm.
Then that's another story, right?
That was another story where,
And then after that, really,
well, the first thing is she kept describing these symptoms of feeling drunk, and I didn't feel safe leaving her in Pennsylvania, so we brought her to North Carolina, and where she proceeded to say after the plane ride she still felt drunk, and I knew at that point we have to take her back to the hospital. So we took her to a hospital where they discovered she had a brain bleed. So all these things, they're kind of like cookie crumbs. People are telling you symptoms. The first thing is you have to believe the patient. You have to believe the patient and get them where they need to be. If you cannot take care of them, which most of us are ill-equipped to do so, but we do have ears, and that's one of the best ways we can help our loved ones. We took her to the hospital, local hospital here in Charlotte, and they did the best they could for her. She did suffer a brain bleed, so that tumor clearly was bleeding. And so at that point, they knew she had a tumor. They knew something was bleeding. That's the reason for all of that. But they had to get her stable. So we left her in the hospital till she was stable. And at that point, you and I started using our pharmacy wits to write up an entire patient case and described all these symptoms and described the brain bleed and sent it off to Duke. And the reason we wanted her to go to Duke was just because they are very curious over there, and we thought, hey, this is a good case for them. So
yeah, I can't even remember how.
That was the reason we went. We just decided let's pick
Google, so it's not like
let's just pick a place that is great for teaching. We love to learn, so. That was what we chose, and we sent this off, and without a doubt, within the next day, we got an appointment. It said, bring her in now. And so we brought her to the hospital, and right then and there.
Yeah, days later, she had surgery.
She had surgery. We got the news that they removed her. Diagnosed, unfortunately, with a severe brain tumor, glioblastoma.
So now at this point, she's in a rehab hospital, right?
No, so they cut out the tumor, and then she went to rehab, right?
Rehab hospital.
Because, with surgeries, it's not perfect.
What happened there?
Well, it was not perfect. And unfortunately, I was working at the time as a pharmacist, and so I would fully have my wits about me. And I went to visit my mother, and I noticed her ear was purple. Her ear was purple. I said, Mom, I hate to do this to you, but I'm going to examine your lower genitalia area. It's going to be uncomfortable, but I have to see if that's purple as well. Then I'm going to check your chart. And even though I'm not privy to that, patients are not even allowed to. Somehow, I was able to sneak a peek and saw that her genitalia was purple.
You don't advocate stealing things.
I'm not advocating that at all, but you can ask some questions, and then her ear was purple. And I said, well, I didn't see you the first time that this happened, but this looks very similar. What have you taken? And she didn't know what she had taken. And so we looked at the chart. They had given her Zocor again. So at this point, I called what did you do? We called the
the nurse was there, and then she ended up calling because this was like really late at night. She ended up calling the doctor on call, who's actually the ER doctor. So he came and examined her, but he wasn't really sure.
Yeah.
You'd explained the whole history of her, Steven Johnson, and Zocor.
And I said, this is the
beginning.
He was
very, I understand his position. He didn't know her history that much, and he didn't want to make a decision right there. Right. So it took him some, back and forth with him.
Yeah. And sometimes
to explain the history and really what she went through.
I think what helped him, and sometimes we as loved ones can be very emotional. What I did do is gave him some space from me, and it
Right.
was kind of threatening, but I did say, listen, I'm going to leave. I think this is Steven Johnson's. I believe, and he went back and forth about they're giving her some steroids. I said that's a lower level, and then he brought the whole point. Well, she's also diabetic. This will shoot her sugar up. I said that's great, but she could suffer from a serious set of infections if we don't treat this with higher dose steroids. I said that may be what is keeping it at bay. And I realized I was talking fast because this is my mother who had just been diagnosed with glioblastoma, and now she's suffering from Steven Johnson's. So I decided you and I got out of there pretty quickly to give him space to make that decision, because sometimes people feel that pressure and they can't think. So you got to give them space. You said what you say, but you give them space to react, and then you receive it.
And then and
by
he
the
called.
time-
By the time we got
back home, he had called.
He called, and then he said that that they were giving steroids and she was doing well, and I mean the whole thing worked out well. And you're right. I mean, giving space, making yourself very clear, and giving space is important
for them to react, because it is stunning.
He felt threatened initially, probably.
Oh, absolutely. That's a lot of information coming
all
to you.
These people are just like shooting all this stuff at him. But, so that worked out well, and that was important.
Yeah, and she made it out of rehab, and she was given a couple months to live. Was that prior?
No, that was prior to surgery.
Prior to surgery,
maybe 2 years after that.
Yeah.
And
she lived a good life after the resection until. As best as possible. Yeah, so I was happy with the result.
Right.
It's just unfortunate sometimes, you can suffer something, but you have to be that kind of history holder, that record, person that bears that those records for the patient. And
so fast forward like 10 years now, or whatever. At least 10 years, and you're in a retail setting.
Oh yes.
And then
that's right.
Out of nowhere.
Yes. So this happened.
What happens?
So this happened again. Working at a retail store, and an African American lady comes up to me. She said, I have this rash, and she just showed me the palms of her hand. And while I'm used to that darkish purple rash, because the pictures I saw, I said, well, this is very odd. She said, is it anywhere else? She said, what do you mean? I said, listen, rashes are funny. It's not a raised rash at all. It was just a darkened kind of skin. And I said to her, listen, why don't you head to the bathroom, and if you find that rash in your genitalia area, go straight to the ER. And just tell them the pharmacist thought it was important that's a medical doctor take a look at this. And I said, it could be you're suffering from a serious reaction, but I'm not sure, and this is not something I'm going to just give you Benadryl for, and I don't know really why I thought that, what clued me into that. It could be the history with my mother. That might have tipped it off. I'm not sure. But when she went, her eyes were as big as saucers, because she didn't want to go. I just walked her to the bathroom and then just kind of walked back. And before I could even make it back to my pharmacy station, I turned around and she said, thank you, ma'am, I'm going to the ER. And so I don't know what the outcome for that story was, but this is just a note to pharmacists too. If it is a rash that is, make sure you're checking out these rashes correctly. Just if you don't know what that is, and it is a dark purplish rash, make sure they check their genitalia area, and if that is affected, that's the signs of, that's one, it could be. I'm not saying it is.
Right.
But just at least get them some help. Be an advocate for your patients. Get them where they can get help. That's it.
Yeah. And that's important. Right? It's important to be aware of things that like this, and also ask questions, because really that's how things come up. Just kind of brushing it off. Oh, rash, I'll
To better drill.
And it's not ideal world. I mean, you don't always have time, but that time,
take that time.
sometimes when you do have time,
Mm-hmm.
and you do need to ask those follow-up questions, because a lot of things will come up. So
that's it.
yes, you did a great job. I mean,
what
somehow
I-
you're the Steven Johnson queen.
I guess.
Like all the Steven Johnsons.
Well, that was just two people.
Patients.
That's two.
Yeah, well, yeah, that's more than.
That's more than I want to see, though, because of what can happen.
All right. Well, thank you, and
We'll see you next time.
We'll see you next time. We'll
with
record
Drugs
more
and Coffee.
like this.